Agents, hey, Luis Moreno here with Think Medicare, Think ACA. We're about 10 days from ACA open enrollment. And it's crazy the amount of emails and comments that I'm getting from YouTube and other agents from all over on how do I quote an ACA policy? Man. All right, so this is what I'm going to do here, guys. I'm going to share with you how to quote. Number one, there's a lot of platforms out there where you can quote. What you don't want to do is you don't want to go to healthcare.gov and do your work there. Okay, it's the last place you want to be doing this at. Where you want to be quoting is you want to be quoting on one of the EDE, the Enhanced Direct Enrollment platforms, like HealthSherpa. So I've got videos on how to go create your own account on HealthSherpa. That's the first thing you're going to want to do. You're going to go to healthsherpa.com and open up a free individual account. Set yourself up on there. Biggest tip that I'll tell you guys is make sure that when you set yourself up and you go to the carriers and you pick your state and the carriers, only check off the ones that you are appointed with. Agents get very, very confused and they think that by checking off there, they think that they're actually getting appointed. That just means you're telling HealthSherpa that you are already appointed with them. So you need to make sure that you get appointed first. Okay. If you haven't got appointed first and you're looking for an organization to partner up with that will train and support you, guys, hit me up. Okay. Send me an email. Oh, you have my email down below, and I'll help you with contracting. And let's assume that you have your contracts. Let's assume that you're already set and you've gone and you've selected the carriers. Now, how do we quote? Well, before we quote, guys, we've got new rules out there. You've got to get consent. So get consent from your insured and then start gathering all of their information. Okay. Now, what information do you gather? So I'm going to share with you my intake form. Okay. I'm going to open this thing up here and share it with you. Guys, I've got a community of ACA and Medicare agents that we're putting together. 25 years in business is what I'm going to be sharing with you. Guys, come join us at the community, a community of ACA and Medicare agents, and we'll show you how to grow. This is my intake form. You don't need an actual form. You can jot all this information down on a sheet of paper. It doesn't matter, but gather it. You're going to need everybody's information that's in the tax household. Gather their name, their date of birth, their socials, citizenship, and whether anybody has Medicaid or CHIP. You don't need a driver's license. I get that because I'm a PNC guy also. I have PNC agency. Get their contact information, their phone number, their email, their address, and their county. Get their employer information, the spouse's employer, and anybody other employer. And if you were not in a room, just jot it down here in the notes section. You're going to get their income for 2024 and their income, what they expect to get in 2025. And then you get their docs and you get their medications. Gather all that data and now have a conversation with that lead. Hey, Mrs. Jones, got all your information. Now, I make it a practice not to gather the social up front if they don't know who I am. If it's a referral, somebody I know, I'm going for the kill. I need your social. If I don't know them, I already know enough to know that it's going to be hard to pull their social when I haven't given them anything of value. They haven't earned the trust yet. Okay, so hold off. You don't need it right now. Let them know that you'll need it later. You don't need it right now. All right, so Mrs. Jones, tell me, what kind of plan are you looking for? What are you wanting your health insurance to do for you? All right, boom, gather that data. Okay, then you're going to go to HealthSherpa. We're going to hop in there right now. Okay, you're going to go to HealthSherpa and you're going to go run a quote. It's not that hard, guys. There's 3 sections right here. There is this section right here. Okay, there's this section right here. And then this is the result of all your data that you entered there. Okay, easy enough. All right. Now, what you're going to do, guys, let me clear this out here. Hold up here. What you're going to do is you got to enter their zip code. Okay, let's assume that I gathered data from mom, dad, and 2 kids. All right, so mom is 35. Let's say dad is 40, and they got a 10-year-old girl, and they've got a 5-year-old boy. Okay, easy. Now, if for some reason the kids were in CHIP, Children's Health Insurance Plan, and they didn't need to be insured, you get rid of them here. Okay, but now that you are in this section right here, you need to make sure that you're accounting for the right amount of people that are on the tax return. So mom, dad, and 2 kids, 2 kids are in CHIP. This is a household of 4. Okay, if you go ahead and include the kids.
This video is being sponsored by Agent CRM. Agent CRM is a CRM that I use for my agency for every line of business: auto, home, life, commercial, Medicare, and ACA. It should be the CRM that you use too. Click up here to get some more information.
Then this thing is automatically going to go to 4. Then you're going to go ask them for their income, dad's income, mom's income. They got a kid that's working, add it all up. Let's say that they're at $80,000 a year. Now, this is your results over here. Okay. Now, based on this income, they are only getting subsidies. These are A, P, T, C, advanced premium tax credits. This is how much is going to be applied as a savings to their monthly plan. Okay. Now, let's say that they made 50,000. Okay, well, look at what happens now. Okay, now they get not only the credits, but they also get cost sharing reductions. And what that is that reduces the co-payments or the deductible, co-payments, co-insurance, and maximum out of pocket for a plan, but only for silver plans. You got to be careful here. You got to pay attention to this section here, because look at what happened here. It's only insuring mom and dad. The kids, the software is thinking that they are eligible for CHIP. If they tell you that they're not eligible for CHIP, then what you're going to do is you're going to check them here, and now they're being insured. But look what happened to the savings is it got increased because now you're insuring 4 people. Now what you're going to do is you're going to scroll down. When you see this little badge right here, when you see this right here, you automatically are going to go to a silver plan. Automatically, no doubt. Okay, I'm going to share with you. I'm going to illustrate to you why. No doubt. Okay, I go to a silver plan. It's going to preload silver plans, and I'm going to rock and roll. Okay, now I'm just basing this on premium right now. Okay, I haven't started checking docs and meds, not yet. All right, so let's do the illustration of why. Let's go to expanded bronze, which is just like a bronze, but it has copays. And I'm going to stick with one carrier just to make this easy for illustration purposes. So I'm going to go to you. Let's go here to Blue Cross, and I'm probably going to choose this plan. Why? Because it's got copays here. I don't like this stuff, the no charge crap, the 50% after the deductible. Insureds don't like that either. I'm going to go to a silver plan. And then I'm going to go to a gold plan. Okay. All right. Now, there is a difference here. This is the Blue Advantage Plus, which is their largest network with some out of network coverage. But anyway, If you caught that, you're like, well, you're not quoting apples to apples. All right, this is still better as far as the network. When you look at this, they're paying zero for all of them. So if you look at it from a pure premium standpoint, what do you choose? You don't know yet. Here's what you have to take into account. Look at the out-of-pocket maximums. Look at the deductibles. Okay, the silver wins. The silver wins on the max out-of-pocket. What this means, guys, if they're in the hospital, their worst case scenario is going to be 94 with the bronze, 8,700 with the gold, but 3,000 with the silver. Why would you not put them with the silver? At this point, I still don't know why you would not. Okay, scroll down and look at the primary care. Primary care is 20, we win. Look at the specialist, we win. Okay, on the deductible, all of them win. On the generic drugs, we win. Again, there's really no reason why not to go with the silver. Okay, hope that makes sense at this point. It is literally this easy, guys. Now we're going to go back and we're going to filter out for doctors. So let's say that they go to, let's say that the hospital that they want to use is the University Hospital in San Antonio. Let's see here, Dallas. I'm going to go find the hospital. Maybe it's just university. Okay, let's see here. That's the pharmacy. That's right here. Perfect. I'm going to add that. Let's say I'm going to add a doctor. Okay. Go add another doctor. Okay. So now, if I compare, now I'm sticking with one carrier right now. Okay. Let's go back here. All right. Let's go look at this bronze plan. Well, the university takes it, but the two doctors do not. Okay, now I'm going to uncheck Blue Cross here and I'm going to start looking across the board. Okay, United, the doctor takes it. This one, doc, does not, and the university is not in that system. Oscar, doc takes it, but this other one does not, neither does university. There's Blue Cross. Let's keep going here. Let's see here. Let's go to page 2. Now we're in the bronze section. There are some carriers that don't offer bronze plans. Okay, so either way, it's not looking very good for bronze. Let's go to silver. Now I'm screwed on the silver plan for my blue. This is a small network. All right, let's go to United. Well, just one doctor, but not the other two. Aetna, the hospital, but not the docs. All right, let's keep going here. All right, I'm trying to see if I can find 2 greens or 3 greens. Man, I'm really not having any luck here. This is what happens. This is what complicates the ease of quoting. All right. All right, man, look at that. So I went through all the carriers and I really didn't hit a home run. Nothing. So what would I do at this point? Very easy. Mrs. Jones, first of all, your 2 docs in that hospital, I can't find one carrier that has all of them in there. One carrier has this doctor, one carrier has this doctor, one carrier covers a hospital and no docs. I don't know what to tell you. You tell me what you want to do. That's the way you do it. Okay. If they're willing to switch docs, you go that route. Okay. Now, if they say, nope, one doctor is not negotiable, I can go to another hospital system. We've got 3 here in San Antonio. I think we got 4. Okay. I can go to one of the other hospital systems, so I'm not worried about that. But I got to have Dr. Daniel Waters. All right, let's go back. Okay, so let's go to doctors and let's get rid of this hospital and let's get rid of that doc. And I want to stick with the silver plan. Well, I know under, let's go back to page 1. Okay, with this zero, I struck out. Ooh, I got United 59. I hit a home run. Yes. All right, I'm going to push that. But remember, I don't like this one, so I'm probably gonna go to the next United and play the and throw this $86. Why? I don't like this 35% after the deductible. All right, it's not a fixed cost. But if they want that one, I'll sell it to them. But I'm going to make them very aware of this. Okay. Now, if I want to, they're like, well, can you tell me what hospital systems this takes? What you're going to have to do is click on doctors. It will take you to that specific carrier provider directory. You can click on places, hospitals, and now I get my list. The Baptist Health System. And I think that's it for United. That's all. So the entire Baptist Health System, I don't have Methodist, I don't have University, and I don't have Santa Rosa. Okay, still, now if it's an emergency, they can go wherever they're taken. But if it's a scheduled event, they're going to have to go to the Baptist. All right, let's go complicate this with a medication. So I can go on here and I can type in lisinopril. Okay. And let's say I type in Januvia. All right. Let's do the generic. All right. We're rocky. Now we chose United. Let's see with United if these 2 meds are covered. Man. So the Cinepril's is covered, but not this one. So let's go add the name brand. Well, that's maybe this wasn't the generic. Who knows? But with Januvia, you would think it is. I don't know why it's not. Oh, maybe it's because it's a dosage. Who knows? But with Januvia, that's why it's important to ask the dosage. It's on my intake sheet, guys. So Januvia is 20 and the Cinepril's is 10. Okay. So, oh, you know what? That's with Blue Cross, but the doctor doesn't take it. Oops. Look at United, guys. United doesn't take the one that I was going to recommend. These 2 aren't here. Cinepro is, but look what it says, covered, see formulary. I got to click on here. It opens up that specific carrier formulary directory. I'm going to type in lisinopril. And it's going to tell me that it's a tier 2. Okay, depending on the dosage. I go back over here. I pull the summary of benefits for this carrier. I go to tier 2, it's a $2 copay. But not Januvia, so what am I going to do? Let's go back over here. Let's type in Januvia. Let's just confirm. Not in formulary, not formulary. So they're going to have to get something else. Now, you don't play doc, okay? You don't start suggesting other meds. If they want to go with this plan, now you're going to have to go with doc. You're going to have to tell your insured, look, you're going to have to go to your doc. Januvia's not covered. You're going to have to get an alternative. Talk to your doc and see if there's a suitable alternative. Otherwise, back to the drawing board. All right, let's see if we can get all green in here. You can also, guys, use this filter in network. Well, this is going to be in network for the doc. It's not going to work here. I'm just trying to find the med. Let's go back to lowest premium. All right, let's go see if we can hit all green. You know what? I gotta take one med out. Maybe that'll give me some green. You kind of see what I'm doing, guys. It kind of becomes a game. Okay. And again, the you want to win by getting all three out of here, but then you got to make sure they can afford it. As I'm scrolling through here, look what's happening to the prices. It's going up. Okay. I may find an all green. Let's see if I get lucky and find all green. I'm already in the high 300s. I'm about to hit 400. Man, well, I got no luck. But let's assume I did. Okay. Are they going to pay $600? So again, it kind of is what it is, guys. You get out there and you try to do the best that you can. Let's say that we're going to go with United. I got the doctor covered. I got one med. They're going to go get another med. It's $59. They're rolling. But let's say, you know what, they don't like this. So they go with this plan. 60 right here, $86. And they just go find another medication that works like Januvia. They talk to their doc. And now you put your head on. And you're like, all right, what am I going to do now? Okay. So you're going to offer this $86 plan. And remember, you got a $3,100, $3,150 out of pocket. It's time to put on your sales hat. When you click on benefits here, guys, you're going to see. You go to the end. Does not cover dental care for the adults or vision. For the kids, crappy dental and vision, if any. Okay, if they need glasses, no charge for the exam, 25% co-insurance, and all they get, the kids, is the checkup, and that's it. So you're going to want to go in here, and you're going to want to quote a dental plan. I use Emeritus. If you don't have it, hit me up. I will send you contracting for Emeritus. You go on in here, pick a plan. Let's say it's for the family. I want dental, I want vision. There's 4 people. Boom. Good, better, best. Pick good, vision, good or better. I pick the best one. I've got videos on this, guys, that will explain all the details. Review and purchase. I knocked this out and I'm rocking. Now, remember when I mentioned about the $3,100 out of pocket. All right. You're going to go on here and you're going to go quote mom, dad, and the 2 kids.
You want to know everything about ACA or Medicare? Click up here to get my ACA and Medicare Smart Books.
It's mom. Okay. I'm going to add the spouse. Add the other kid. All right. Quote. I'm going to go straight to accident. Parents has never smoked. The effective date. Let's see here. Messed up there. There we go. That'll work now. Okay. I'm going to go on here. Remember, $3,100 out of pocket. I'm going to go choose this $5,000 benefit because I want to cover it all and then leave them with some extra money. I now have an accident medical expense of $5,000 reimbursement for them. But I'm going to go add the sickness plan, which if they are admitted into a hospital in 24 hours, they stay there 24 hours, they will get a check for $5,000. Okay, this is now going to be $92. Okay, now the 2 adults will have the accident All four will have the accident and only the two adults will have the sickness. Okay. And you're ready to go. $92 plus 179 plus 86. You've got some choices there. So you pick all that and you decide what to offer. Now it's time to make your presentation. Mrs. Jones, I have put a package together that most of my clients take. This package includes your medical, your dental, your vision, and then 2 supplements that will cover you in case there's an accident and also in case you're hospitalized. Total price is whatever it is, and then shut up. See what they say. Okay, they can't afford it, then you start detracting from it and find what fits in their budget. Worst case, you sell the ACA and you're golden. But you never want to leave money on the table. Don't let some other agent sell them the dental and vision or the indemnity plans. Make sure you're doing an entire package. God, I hope that helps you out. Guys, down below, look what I got for you. Down below, I've got my ACA and Medicare Smart Books. These are my resources for business, for my ACA and my Medicare business. Okay, you can go down there, click on them, and go buy them. Secondly, I've got an ACA 101 course that I did for 2025. If you suck at ACA, you've never been trained, you know what to do, go get my course. I have Agent CRM, okay, the best CRM in the universe. Okay, you got to have a CRM, guys. Okay, it's your communicator to talk to agents or talk to clients and your leads. And there's more to it. And then I have the ACA marketing pack. I have the Medicare marketing pack, which teaches you how to run social media ads for ACA and Medicare. It teaches you, it has a webinar in the box. It's got 1 free month of Agent CRM. There's a lot of value to it. And then finally, guys, we are creating a community. Now it's a paid group. It's $50 a month. We're going to be doing so much for you guys. Okay. On the community, let me see if I've got this page pulled up here. Okay. In fact, let's see here. Where is the community? Let me pull this thing up. You may want to consider joining the community. The community is pretty cool, guys. If I can find the page, give me 1 minute here. Okay. Let's see here. I'll eventually find the page. Well, I thought I'd have it ready, but the community, guys. In fact, I'm going to pull this thing up. Hold on here. The community. Where is this thing? You're going to really may want to consider joining the community. Here we go. I've got it for you. Now I'm going to share it with you. Look at what we're going to do in the community. Okay. So we're going to help you guys with quotes, client scenarios. Okay. So you send us the client scenario. We will help you quote it. You got to give us a little bit of information. We're going to do a weekly mastermind during OEP and then a monthly afterwards. Add templates for you, a PDF of ACA terminology. We do a lot of stuff with AI. We're going to bring all that to you. I'm going to have workshops on financials, taxes, business planning, okay, lead gen, care-specific trainings, your compliance and recertification help. Okay, I'm going to try my hardest. I've got tech tools out there that I have purchased, but if I've guaranteed that we're going to bring volume, so they've given us some discounts on these tech tools. Bring that to you. And I'm going to show you how to cross-sell like no other, so you guys can make a lot of money. So come join us on the community. I'd love to have you. We're going to bring a lot of value to you. I hope this video helps you out with ACA. Comment, like, and please do me a favor, subscribe to my channel. I'm trying to grow this thing. I definitely would appreciate it. Thank you so much. This is Luis Moreno with Think Medicare, Think ACA.